Hot weather can really be a concern for your body.
Yeah, the combination of high temperatures and high humidity can increase your chance for a sunburn and dehydration, but also heat exhaustion and stroke.
So let's talk about all of this with Dr. Jeff Pothof, an emergency department doctor from UW Health. He joins us now with some information about the heat. Thank you very much for joining us. What is the first
Thank you.
thing that concerns you when you see these temperatures combined with heat and humidity?
Yeah, so what we worry about with the high heat and the high humidity is that the human body can't use evaporation, our primary way to cool ourselves, once that humidity gives about 75%. So we're at a disadvantage when temperatures get this high, and we run the risk of getting a little bit too warm and getting ourselves in trouble.
Dr. Potoff, what are the best ways when the air is this thick outside and it's hot to stay hydrated? We know about water, but is there any other things we can think about as we want to make sure our bodies feel right?
Yeah, I mean, the really important thing is to plan ahead. So if you know you're going to go outside, make sure you do bring water. There are other fluids that can replace both the salts and the water that we lose when we're out in these warm environments. A lot of the sport drinks are acceptable. Some of them have a little bit too high of sugar concentrations, but you can look on the label and figure that out. There's other solutions too, like Pedialyte that we often use for kids who've got, nausea, vomiting, diarrhea. But those are perfectly acceptable solutions to use in the high heat too, to get kind of that balanced rehydration that we're looking for.
Yeah, it's important to stay hydrated, and if you're working out, to try to get that workout early in the morning versus midday. But how do you treat these heat issues?
Yeah, so it depends on how severe the individual is when they come into the emergency department. The first stages with heat exhaustion, oftentimes you'll see fatigue, nausea, sometimes vomiting, lightheadedness, and if we can catch it early like that, we can often turn these patients around with fluids, with cooling. Now, heat stroke is the more serious disorder that we see with these high temperatures. Those individuals are often confused. They may have stopped sweating because they're so dehydrated. Those individuals frequently require admission, long-term or longer stays in the hospital to get things turned back around, much more serious condition.
Dr. Potoff, there are people who just have to be outside. They work outside, they're construction workers, and they really don't have a choice to go inside the air conditioning. Any advice for those people?
Yeah, so hydration, like we talked about, is very important. Make sure you pace yourself. Today is not the time to beat the company record on, most repetitions or most things done in a day. If you can, look for those shady spots. See if you can find a breeze. That can be helpful. Even cool mist that you can mist yourself with can help your body evaporate a little bit quicker and cool down. But it's a rough day for those folks who need to be outside.
Dr. Jeff Potoff, we appreciate your insight and being with us this afternoon, and we tell everybody try to stay cool. Thank you, sir.